I'm Beverly Kirk, Director of the CSIS Ideas Lab, here with Heather Conley, Senior Fellow and Director of the CSIS Europe Program. She's one of the authors of a new report on the changing landscape of global health diplomacy. Thanks for being with us.
Thanks, Beverly.
So, your focus is on a transitional moment in global health leadership. Explain that.
Yes, what we mean is there are a couple of really important factors that are changing the landscape of how Europe sees development assistance. The most significant is, of course, the European sovereign debt crisis, austerity. European governments that have been extraordinarily generous in development assistance have been having to shrink budgets, something, of course, we understand here in the United States as well. The other shifts in landscape is really that government development assistance has really been a shrinking part of the pie. What is growing in development assistance is private donations, foundations like the Gates Foundation, companies that are making important contributions. So Europe is trying to adjust to shrinking budgets, a more difficult economic landscape, and other development actors, including emerging economies that are entering the scene, and they're trying to figure out how best to use their important resources and work with the United States to help leverage and maximize our global development assistance.
And one of the key points the report talks about, it says it's time for a, quote, health diplomacy strategy. What does that need to be?
Right. That's really the key point. What we found in our study is that we see these glimmers of leadership in health diplomacy. Great Britain has been extraordinary in their leadership of development assistance and in particular health. We see glimmers of that in French diplomacy and their leadership in the Global Fund. But how do we sort of work together with Europe and really make a concerted effort at keeping health development assistance high, making it multilateral, and really solving significant problems? This is what we're arguing. It's time to join together, have a focused strategy, and again, appreciate that development assistance, the landscape is changing, and how do we adapt and develop a more focused strategy.
So what's next?
Well, we have some upcoming summits which will be very important to furthering this discussion. In June of this year, G8 leaders will meet in Northern Ireland. Their focus will be on food security and how the Western countries focus their efforts on that development agenda. Then in September, the G20 leaders meet in St. Petersburg, Russia. We hope development and the development agenda will be firmly in place, and in past G20 summits, how both the West, the developed countries, and the developing countries work on the development assistance agenda. We hope to see more activity from Washington and focusing on health diplomacy, working closely with the UK, with France, with Germany, and others to help forge that new health diplomacy.
All right. Heather Conley, thank you.
Thank you.